Has your little one gone from this to this? And are you noticing the number on the thermometer just keeps on going up and up and up? It's worrying, isn't it? I want to talk today about when you should be worried about a fever in your child. But the other part of it is this: not only how to treat a fever, but if you should treat a fever. In my day-to-day job as a GP, I see sick kids all the time, especially during the winter months. And I want to answer that question, how hot is too hot, in just a moment. But first, let's just define what a fever is. It's a body temperature of 38 degrees Celsius or above. When I hear parents talk to me about the temperature of their child, I hear the anxiety in their voice as they tell me just how high that number is. The fact of the matter is, though, it doesn't really matter that much. You either have a fever or you don't have a fever. But there are two important aspects I need to cover here. Firstly, we need to concentrate on the child rather than the number. I'm more worried about a child with a temperature of 38 degrees who looks really unwell compared to a child with a temperature of 40 degrees who's up and playing and eating and drinking. But that being said, the second part of this is, if you want a number, I would say 41. 41 degrees. And the only reason I put that there is once you go above that temperature, you get into the realm of potentially having a febrile convulsion. Now, these sound scarier than they are. Sure, they are seizures, which is frightening, of course, but they're due purely to a high temperature. So once the temperature comes down, no more seizures. So understanding why fevers happens helps us answer something later on in the video. Fevers are your child's way of activating their immune system to increase their body temperature to help kill germs and get them better quicker. So when you see the temperature on the thermometer going up and up and up, you can partially reassure yourself that this is their way of fighting the infection. But we're going to come back to that later on in the video. Next, let's talk about what the fever actually represents. So if I'm thinking out loud and being very simple about it, fever generally equals infection. And if your child has got a runny nose or a sore throat or a bit of a cough or a cold, you know that's going to be fine and they're going to get better from it. But when should you be a bit more worried about something more serious going on? Well, these are what I would call the red flags. You need to be seeking help if your child is under 3 months of age and they have a fever over 38 degrees Celsius. If the fever is lasting more than 5 days. If the child is floppy, drowsy or hard to wake. A rash that won't fade when it's pressed, a non-blanching rash. Struggling to breathe or refusing fluids. Or signs of dehydration, which is like a dry mouth or less wet nappies. Now, most fevers are just the body's way of getting better, but trust your parental instincts. Something doesn't feel right? Get help. So there isn't a definite yes or no answer to this question, but once again, it goes back to the child, not the number on the thermometer. So if you have a child with a fever who's well, happy, can smile, and can play and eat and drink, but they have a slightly high temperature, then you probably don't need to do anything about it. But on the other hand, if you have a child that's clinging onto you, feels super hot, isn't interested in taking any food or drink, then that temperature is probably doing more harm than good. So, leave it if the kid is happy, treat it if the kid is unhappy. And here's how you do it. There are several ways to get that core body temperature down. And some are easier than others, and you don't have to use medications necessarily. So firstly, think about putting cold stuff into their body. So that can be water that's had some ice in it, sucking on ice lollies, or refrigerated milk. That's a great way to get the temperature down. Next, make sure that they're not huddled up too much and you take their clothes off. Also, feel free to open a window, let some cold air in. So you've got a cold environment on the outside, and you're now getting a colder environment on the inside to bring that temperature down. Now, with medications, the two we know of are paracetamol or Calpol and ibuprofen. Now, paracetamol is probably a little bit safer than ibuprofen, But paracetamol lasts about 6 hours and ibuprofen lasts about 8 hours. So maybe ibuprofen is one you want to give before the child goes to bed to help them sleep that little bit longer if they need these medications. The beauty of these two is that they don't interact with each other. So you give them paracetamol and ibuprofen alternating. So let's say you give your child paracetamol. You check their temperature, have a look at them 2 hours later. If they're still grizzly with a high temperature, then you go in with the ibuprofen. 2 hours later, you're actually back to the Calpol again, and 2 hours later the same. So you should have, between all those measures, plenty of ways to get the temperature down. But remember, the goal here isn't necessarily the number on the thermometer, it's to get your child a bit happier and a bit more comfortable. That being said, with all those measures, it's very, very rare that I don't see a temperature being controlled once they're implemented. I have to put this section in here because I've seen it happen too many times, particularly the first one. The first one is where a child comes in from the car and they have been bundled up in 5, sometimes even 6 layers of t-shirts, jumpers and coats. What you're doing there is you're essentially creating this furnace for that temperature to rise and rise and rise and reach that 41 degrees that we don't want. So there's no need to completely bundle up a child when they've got a fever. In fact, it's the opposite. Take clothes off. The second one is cold baths. It's just a bit cruel. Don't do it. And the last one is medication. Yes, it's a great tool to get temperatures under control, but it's not going to kill an infection. It's not going to kill a virus. It's there to make them comfortable. So if they're already comfortable, there's no need to force ibuprofen and Calpol down their throats. So no one wants to see their little one sick, do we? But hopefully fevers are a little less frightening after watching that. But what do you think? Should we treat fevers or should we let them be? Thanks very much for watching, and I'll see you again soon.